How can lung cancer patients manage a cough impacting work and exercise? If you are dealing with a persistent cough due to lung cancer, it can be frustrating and interfere with your daily activities like work and exercise. The good news is that managing this cough involves understanding its causes and using a combination of medical and lifestyle strategies. First, it's important to identify and treat any reversible causes of the cough. These could include infections, airway blockages, or inflammation. Your healthcare provider might prescribe antibiotics if an infection is present, or corticosteroids to reduce lung inflammation. Bronchodilators can help open narrowed airways, making breathing easier. In some cases, targeted cancer treatments like chemotherapy, immunotherapy, or radiation can shrink tumors that cause coughing. Medications specifically aimed at controlling cough can also be helpful. Cough suppressants, whether over-the-counter or prescription, can reduce the cough reflex. For more severe or persistent coughs, opioids like codeine or low-dose morphine are sometimes used under medical supervision. Inhalers containing corticosteroids or bronchodilators can soothe airway irritation and improve breathing. Nebulized lidocaine is another option in certain cases to numb the airways temporarily. Alongside medications, simple lifestyle adjustments can make a big difference. Staying well hydrated helps soothe a dry throat and reduce coughing. Steam inhalation or warm honey can also relieve throat irritation naturally. Breathing control exercises and relaxation techniques can help reduce tension in the throat and suppress cough reflexes. Gentle massage of the neck or shoulders may ease muscle tightness that worsens coughing. Using devices like an incentive spirometer can improve lung expansion and decrease cough severity, especially after surgery or during treatment. When it comes to work and exercise, pacing is key. Plan activities with regular rest periods to prevent exertion from triggering coughing episodes. Working with a physiotherapist or exercise specialist can provide tailored breathing exercises and airway clearance techniques to help manage mucus and reduce coughing. Avoiding known triggers such as smoke, strong odors, cold air, or allergens is also important. Using prescribed inhalers or medications before physical activity can help minimize coughing during exercise. If your cough continues or worsens despite these measures, it's essential to consult your healthcare team. They can review your treatment plan, consider additional therapies, and provide support to improve your quality of life. Remember, managing a cough in lung cancer involves a personalized approach that combines medical treatment, symptom relief strategies, and lifestyle adjustments. Always seek advice from your healthcare provider to find the best plan for your specific needs and to ensure your lung health is protected while maintaining your daily activities.